Welcome. My name is Nancy Coxwell, and I'll be guiding you through this presentation on Orum's self-care nursing theory. Dorothy Oram was born in 1914. After graduating high school, she attended nursing school, eventually earning a bachelor's degree and going on to her master's in nursing. She served many roles throughout her nursing career, from a floor nurse, a teaching nurse, preceptor, dean of nursing school, to developing nursing curriculum, and then ending her career as a technical nursing expert. Oram stated her theories arose from her clinical practice. She did not attribute them to any other influence. Oram's theory focused on the influence of the environment on the patient's well-being. She maintained the need for the basics of air, water, nutrition, and clean, safe environment. Oram believed the nursing process is an interpersonal relationship between the nurse, the patient, and the patient's family. Now, Oram's theory is considered a grand theory because it is comprised of three different theories that together encompass the broad area of nursing. The theory of self-care is the patient's ability to perform activities of daily living on his and her own to maintain the patient's desired quality of life. The self-care deficit theory determines when the nursing care is needed to assist the patient and his or her ADLs. This could range from as little assistance as helping a patient put toothpaste on a toothbrush, to complete head-to-toe care. Also, there are different levels of assistance that include teaching, making sure the patient's environment is conducive to the patient's best health, and/or providing psychological support. The theory of the nursing system is similar to the care plan in that it's created by the nurse practitioner, based on the assessment of the patient's abilities to achieve those needs. Oram's theory incorporates the human being, or we can replace the human being with the family, and it incorporates them in two perspectives. First, the family members pursue their individual best from day to day. Just as family roles and responsibilities evolve, this is a constant changing that involves the need for continuous self-maintenance and self-regulation to improve each individual's self-care. Now, Oram noted that the family members are able to be active in self-care individually and also providing assistance to family members in need. So in the family, everyone has the prospect and the aptitude to learn how to meet his or her self-care needs. Oram describes to the World Health Organization definition of health, but she gives the human being more autonomy in that definition. So the human's decision of health is what they believe their health is, and that could change based on their individual physical and cognitive situation. Furthermore, Oram believes that the integral part of health is preventative and mental health. In regards to the environment, and we've touched on this just a little bit, she believes that the environment or the definition is the basics of air, water, nutrition, and a clean, safe environment. And isn't that a concern for every provider? The definition of nursing is that it's a human service. Unlike some other social work, like a social worker, licensed professional counselors, nurses assist those in need who could not provide self-care. They don't just provide guidance and education, they actually provide the task and the help needed. Let's take a minute and look at Oram's influence on the analysis in nursing practice. While serving as a technical expert, Oram contributed to the improvement of the licensed practical nurse training, helping them to gain more skills, and they can be a benefit in any provider's office, in a family care provider office. Oram's theory can be useful in all levels of nursing expert to help identify the interventional needs with patients. By assessing the patient's ability for self-care, the nurse, from levels of expert to beginner, can notice self-care deficits and develop an appropriate care plan. This helps the nurse understand when the nurse's assistance is needed. It also encourages the patient to provide self-care as much as he or she can and allow the nurse to only assist when needed. And also, Orm's theory of self-care includes prevention as well as nursing intervention. Orm raised the level of responsibility in the patient towards his or her health. The patient needs to take a proactive approach and not just a reactive role towards mental and physical well-being. It has daily application in family care. From teacher to resource to surrogate, the nurse provides the information and the education and sometimes a shoulder to cry on when a patient needs it. The nurse provides information regarding diseases or illnesses, providing that educational resources. Also, to help the patient with self-care, the nurse provides resources like spiritual rehab and home health. This gives the patient greater access to prevention and maintenance. Providing resources to patients is expected in the hospital and also in the family clinical setting. A nurse that doesn't provide those nutritional counseling would be derelict in his or her duties. So today, nurses often stand in place of missing family members and guiding people to correct nutritional needs, providing them with information, resources of anything from swimming to finding groups to go walking with to keep from being lonely and depressed. Also, it's really helpful in using Orm's theory of family care when you're dealing with children with chronic medical conditions. Those children need to learn how to accept and actively participate in their self-care instead of depending on parents or just burying their head in the sand and hoping that the disease goes away, or as some teenagers do, feeling invincible that it won't bother them. This incorporates the family in providing assistance and guidance also, as well as helping the child learn self-care. Now, one of the struggles that every provider has is compliance with type 2 diabetes management. So using Orm's theory of self-care, they can develop a plan that's going to help the person in the family understand the radical change of lifestyle necessary, because this means a change for the entire family. By incorporating Orm's theory, the family understands the importance of the diabetes plan, self-regulation, and the contributions the entire family makes. If one family member is eating chocolate in front of a family member with diabetes, that's not helpful, and that can be a deterrent. So this is why it's important that the family contributes in the care, and the whole family is part of the self-care plan. Impact on research projects spans the globe. Research from the U.S. all the way to Iran incorporates Dorothy Orm self-care. So the Orm self-care program is very helpful with hemodialysis patients by enhancing their self-care capacity, encourage medical compliance, and reducing the dependency on other individuals. The program is being developed based on educational needs and requirements of scientific methods, and it's proposed as a nursing intervention among patients receiving hemodialysis. Also, something very important for mothers of children with PKU, Orm's self-based care helps mother develop a 40% stronger confidence level and their ability to handle the special needs for PKU children. Orm's self-care program was implemented to improve the disease process in MS patients. This research study recommended that healthcare organizations use the self-care program as an easy and beneficial intervention. After this clinical study and the intervention, they reported complications including balance disorder, muscle cramps, fatigue, urinary incontinence, constipation, or to name a few, had significantly improved. This theory is going to be used in my family assessment because it helps family and each individual member realize their full potential and quality of life during times of wellness and illness. The family I am assessing has struggles with illnesses that impacted every member. And that's why I think it's so important that every member of a family understands about self-care. Thank you for joining me for this presentation on Dorothy Orum's theory of self-care. This is a list of references used throughout the presentation, and more references used in this presentation. I hope you enjoyed the presentation. Thank you.